Loftier City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Who here feels indebted to chiropractic, right? Goodness knows how I'd be if not for chiropractic. I was born with a wedge-shaped L2 vertebra, and I'm so blessed that I discovered chiropractic at the age of 20. I don't know how I'd be. Chiropractic any good for spondylosis, Jeffrey? Spondylosis, chiropractic? Anyway, save up all your questions about the back for afterwards, okay? So I really salute Jeffrey for not rolling over and going back to bed. So please, I believe you're about the only Farang chiropractor actually licensed in Thailand, is that right? Or in Chonburi province? So there you go, that's quite something unique. All right, welcome to Dr. Jeffrey, and give a round of applause, not just to him, but to all the chiropractors everywhere, as far as I'm concerned. Feel free to walk through and you don't have to stay on the stage.
Well, thank God I'm not the only chiropractor in Thailand. There's a few here and there. Bangkok's a long way to go to see a doctor. And I would like to say that in Bangkok, where things are more expensive, so are doctors, and they charge about twice as what I do over here. Excuse me if I read a little bit while I'm talking. I'm waiting for my second childhood to improve my memory and decrease senility. It has been said that when we are young, we squander our health in search of wealth, and when we are older, we spend our wealth in search of health. Where is the balance? Health is wealth. All that we do to care for and nurture our body, our temple, is an investment in self. Everything from choosing a soft toothbrush to a good quality mattress is caring for number one. And make no mistake about it, you are number one. If you're not feeling 100%, you can't give your dear ones 100%. Time spent on stretching and exercising, good nutrition, a heaping tablespoon of moderation, caring for yourself with massage, enough sleep, calming time like meditation, physical therapy, chiropractic, wholesome recreation, and laughter therapy all add up. Many people have lost faith in drugs and surgery that treat the effects basically rather than the cause. Too many side effects. Antibiotics have a place, but are often overprescribed or misused. Bones include teeth. Brushing your teeth in a gentle circular motion with more attention paid to up and down due to the spaces between the teeth is advised. And when finished, move on to the teeth, to the gums, and with a little more firmness, maybe 10%, pushing down only on the upper gums and up only on the lower gums. So the motion would look basically a circular motion, so you're pushing down on the upper gums and pushing up on the upper gums. It is not the toothpaste that cleans the teeth, it is the brushing. Nowadays there are chemical cleaners and pastes, but some are too strong for enamel and have been removed for the market or should be. It has been said to moisten the toothbrush, shake it loose of excess water, apply a small amount of toothpaste of your choice, apply a 70 to 30 combination of baking soda and salt, and gently brush. If you do this on a regular basis, gums will stop receding, pockets in the gums will fill back in. Start gently. Get a good mattress and turn and or rotate it every 3 months. Spinal care. I mentioned stretching. Flexibility, in my mind, is more important than brute strength, as evidenced when you walk down the street and see people doubled over due to trauma, degeneration, etc. Done daily, stretching shows gradual progression. If done for years, the rewards are demonstrably greater ranges of motion. Physical therapy has been gaining popularity for about 80 years and has advanced. It initially began with massage and hot and cold therapies, and then progressed to use electrotherapies. Chiropractic has been around since it was created about 125 years ago. The university education has evolved into a 4-year curriculum after college. A small number of DCs, doctors of chiropractic, go further to postdoctoral degrees in fields such as radiology or neurology. I chose a 3-year postdoctoral course in orthopedics. As he mentioned, there is only one doctor of chiropractic in Chonburi province that is licensed by the Ministry of Public Health, and that is me. I've lived in Pattaya for 17 years and have kept my hands golden with occasional challenging cases. It's taken quite a while to get both licensed and then a work permit, but the work is paid off with many satisfied patients. I have studied and practiced for 50 plus years in 35 countries and licensed in healthcare for about 50 years, evolving from a massage teacher to a physical therapist and on to a chiropractor. I've seen many techniques, studied acupuncture in China, Hong Kong, and America, seen different soft tissue and osseous techniques, but I prefer the gentle ones. The more that you, the patient, get involved in your own healing, the faster and more complete will be the results. I'm working at Tara Physical Therapy Clinic with 3 very reputable physical therapists, 2 of them experienced and skilled lay therapists using such modalities as lasers. Many benefit from combining physical therapy and conservative chiropractic care. Usually people do not seek out chiropractic care unless they were involved in an injury or know a family member or a friend who benefited from chiropractic care and introduced them. There are 3 phases to chiropractic care: relief, correction and restoration, and maintenance. Maintenance, just like you give your car tune-ups and regular checkups, so it stays dependable and in top performance, just like we'd like our body to be. Doctors of chiropractic realign spines and restore normal motion. A vertebra can subluxate in different positions: lateral flexion, rotation, flexion, extension, or combinations thereof, and stay there until it is treated or progress to affect surrounding vertebra, ribs, soft tissues, and then nerve interference gets involved. The spine is an integral unit. Chronic low back pain can cause neck pain, and chronic low back pain can cause neck pain, and chronic neck pain can cause low back pain. The sooner that a problem is treated after an injury is the faster and more complete the recovery will be. Caring for oneself is never ending. Some benefits to chiropractic are reduced pain, improved circulation, better posture, clearer thinking, decreased tension and blood pressure, relieving low back, mid-back, and neck pain, as well as headaches, greater energy levels, a greater sense of well-being, easier breathing, improved immune function, better digestion, more balanced hormones leading to decreased nausea and mood swings, decreased constipation and reflux, increased confidence towards childbirth, shorter labor times, less need for intervention during birth, improved postpartum recovery and milk production, less chance of injury for the newborn, sleeping better, and more flexibility. Consider the 60 to 90 pounds of force that a baby has to deal with at birth, pushing by the mother, pulling the neck and arm by the doctor, clavicle fracturing, nerve stretching and tearing, plus, including subluxating the spine. Almost all of us has been to the hospital for our own birth, and all have suffered the risks and maybe even have some problems now that you haven't been able to pinpoint a cause. Look to your own birth. Then the helpless child is spanked until breathing starts in too bright of a room. In Finland, an old custom is to give birth in the sauna with the window closed and gradually opening it for a week to allow the newborn's eyes to gradually become accustomed to the light instead of this bright, overly bright light in the delivery room. Midwifery might be preferable, with access to a hospital in case of emergency if needed. And they call life the school of hard knocks. Chiropractic adds years to your life and life to your years. Any questions?
That was to the point and brief as some of my chiropractic sessions have been when I've been to a chiropractor. Thank you.
It was a great talk, and I think very useful. Can you tell me something about what you had to go through to get certified in Thailand?
I studied for 8 hours a day for 6 months to pass 7 exams over 2 days, and when passing, then have to go on to get a work permit. Chiropractic in Thailand is in its infancy, and they don't know what to do with us. So they require a chiropractor to work either with a medical doctor or a physical therapist, even though in most places in the world, a chiropractor is highly trained, more so than a physical therapist. Physical therapy is at least recognized in Thailand, and so we have to bow to their preferences and work at one place or another, or have a therapist or a doctor come into the clinic and make themselves available.
Thank you very much for that. That was very interesting. I have a question. I confess I know very little about chiropractic. Well, why does it come in for so much criticism, or why is it so misunderstood?
Medical community likes to keep control over everything health care, and chiropractors, to them, are a thorn in the side. At least traditionally. Nowadays, medical doctors and chiropractors, therapists, acupuncturists are opening multidisciplinary clinics together, and the boundaries, how shall we say, discrimination has been reduced, and younger, open-minded medical doctors actually refer to chiropractors and vice versa. Regarding your question on the spondylolisthesis, this is a slipping forward of a vertebra, usually because there is no osseous support to it. It's not possible to permanently correct that. It can be treated symptomatically and with proper technique reduced a little bit, but this is more of a permanent condition that requires a lifetime of careful lifting and activities. Osteopathy traditionally has dealt with the artery as supreme, believing that without adequate blood flow to and from any part of the body will result in degeneration and death. Chiropractors believe that the nerve is supreme, and any impingement upon the nerve with osseous, muscular, etc., can interfere with proper nerve flow and cause degeneration of parts of the body farther away from the spine than just the spine itself. So I have studied under, my best teacher was an old school osteopath who was a veterinarian, and then an osteopath, then a surgeon and a brain surgeon, and threw it all away just for manipulation. This guy studied with Knute Rockne and other very qualified people of his time, and he would turn babies around in the womb, pass stones, effectively treat with cranial manipulation blindness and deafness in some cases. And he was the best I've ever seen. He said he was going to die over the table, and he did. I just hate to be the patient to look up and see the doctor falling down and having that on their memory for a while.
Thank you for that. And you brought up osteopathy, if that's a correct pronunciation, which I'm sure it's not. When I was playing football, I injured my back. On Sunday after the game, I couldn't straighten up at all. The football club who wanted me to play the next week sent me to an osteopath, and I was fine by Thursday night for training for the next game. Later, that osteopath retired, and later on I couldn't find another one, so I went to a chiropractor, and I got a similar relief, albeit in a slower process. So I can certainly endorse that what you do is very effective, and certainly the football club wouldn't send me somewhere where I wouldn't be treated properly. Just one thing that I didn't quite get my head around early in your talk was you talked about the restoration of teeth. What was that in regard to?
With respects to chiropractic care being involved with relieving pain, first of all, correcting and restoring normal function and nerve supply, taking an area that has been neglected due to pain and spasticity, and straightening that out and restoring it to its normal position and function.
And that's beneficial even for issues in the mouth and whatnot.
Every part of the body. Osteopathy, osteo meaning bone and pathy meaning degeneration or disease, is a valid form, and they use basically, shall we say, more wider leverages than chiropractic short thrusts. Myself, as I mentioned before, I prefer to go very gentle on a person. I don't like to sign people up for 50 treatments or coming down on them very hard with a sledgehammer. I prefer to give a person 3 treatments, talk at that point and see if they're better or not, and do gentle approaches, especially as I get older, and we all do. I find that gentle care is far more preferable and less injurious than more aggressive forms of therapy.
Yeah, thanks very much, because I never really understood before what the difference was. I regarded them almost the same.
Originally, it was osteopathy with the artery supreme and chiropractic with the nerve supreme. Nowadays, especially with me, I combine them two and try to work on both for the benefit of the patient.
Thank you.
Yeah, excuse me. Yeah, I'm very interested with people getting older and possible spinal deterioration. Do you find that you, before you adjust them, that you think they might need to get an X-ray if they haven't been getting adjustments before? Because there was a Farang chiropractor who died, and he wouldn't adjust my lower back without getting an X-ray, though he would adjust my upper back and neck.
If I suspect there's an underlying cause that would be beneficial to get an X-ray to visualize, I would say yes. If somebody comes in and has an X-ray, I look at that. If somebody comes in and says, I don't have an X-ray, but I'd like to give it a try, I would give that person 3 gentle treatments. And if that person is of no improvement or a little worse, I would send them in for X-ray and have it done. But as far as a standard requirement, I would have to disagree with Dr. Peck and only do it when necessary. I don't like to unnecessarily expose people to radiation.
You recognise the chiropractor, that was good. He's deceased now, I believe, is that right? Yes. Anyway, one thing I should mention while I think of it, there's a place on Tepresett Road, it's not open all hours and it's quite close to Taupara Road on the left-hand side as you go to Sukhumvit, and you can get an x-ray and a consultation for like 1,500 baht there. And so it's really worth it. Do you know about that place?
Yes, there's one there. There's also one on Pattaya Thai near the gas stations. They will do a report. They will take the x-ray and discuss it with you and give you the report and x-ray to bring in to me to review and see if I see anything different, and also discuss it with the patient so they get a clear idea of what we're looking at. It's not just speculation, it's there in black and white.
Yeah, also because of my wedge-shaped L2, I get people saying things like, oh, you should try this stretch, or classic one, I swim as part of my exercise, and these people see me swim and they said, oh, you should reach out more underwater, right? You should reach out when you swim, right? So I did that. My lower back went into spasm, because the wedge-shaped L2, things are out. I had to end up having a number of chiropractic treatments. So now when anybody suggests exercises or massage or whatever, I say, how much experience have you had advising people with a wedge-shaped L2 vertebra, right? Because, designing exercise programs for people with backs, whereas, of course, you have that sort of experience.
Like I mentioned, I tell people to get involved in their own care. I can't do it all myself, but the more they get involved, the faster and more completely they get well. You were obviously very anxious to get well and maybe overdid your swimming, whereas starting very gently and gradually progressing, like every stretch or exercise, may have been better in your case.
No, my swimming was fine. The mistake I was listening to people saying, oh, your style is wrong. When, you should reach out when you go underwater, not just pull your arm back, and that's what put my lower back into an issue. The swimming was fine until I took somebody's advice that I should have never taken, right? Anybody want to share an actual back issue they have that's bothering them, that they're aware of? What are you doing? You got a breast issue over there, James, have you? All right, well. No questions, all done, all change?
I'm just curious, what fractions of your patients are Thai and what fraction are foreigners? And do they have a different attitude about you as a chiropractor?
With Farong, I get easier communication, and when I say I would like you to do this and this and this, come back twice next week and let's follow up and then talk story. The Thai individual seems to be, in general, a little bit more self-motivated and have their own schedule, so even though I may advise them, give me only 3 treatments, they come in one time, and because I give them 100%, they feel much better, but I haven't communicated clearly the need to come in 3 times. Even though I mentioned it, I haven't gone into detail, hoping that it would be understood. And they say, oh, I felt better. Why do I need to come back? Well, we need to go more than just first aid. We need to go to the correction and restoration, and then to maintenance after that. If you value caring for your car, you should give that same love and respect to your body and take care of yourself.
So I suffered by an older accident, and my left muscle side and the right muscle side is disbalanced, and this caused a lot of problem to my backbone. So what I'm using is also the, what is the name, the fascian roll-on. You know what I mean?
Is that an exercise ball?
No, it's to roll on, like put a glass on, but it's a plastic to roll on to stretch the fascia.
I believe in stretching daily, twice a day if you need it. It just takes a little bit of willpower and motivation. When you do that, you're going to start feeling looser, but too many people do it overly aggressive and hurt themselves, get discouraged, and give up. This is why I tell everybody who comes in, any new exercise, any new stretch, start gently and gradually progress. And when you do this, it's safe, it's normal, and you will experience the benefits. Anything else?
Some people in Australia and elsewhere, they've been saying, you know, they have like permanent sort of deterioration in their spine possibly, and they're using inversion therapy. They like invert themselves to stretch the spine once a day or something. Is that something you have experience with?
Yes, I've had them in my clinic before, and most people really like them. The whole idea of traction compression is that not only can you hang upside down for a prolonged time or upside down, you can get this pumping motion because the discs have very little vascularity, and only by pumping do we get increased blood flow there. So by using the backswing or inversion booth, you get this pumping motion, and this is very good. Like any stretch or exercise, it should be started very gently, and don't try to keep up with the Jones next door, just from where you are at the present time, your own tolerance. And listen to your inner voice. It's your best friend, and it will give you advice on what to be careful about and what to do. So with even moderation on that, you're going to find that if you practice common sense, moderation, you're going to have much better results than if you roll up your sleeves and just dig into lifting that bag of cement.
Are there any basic introductory stretches that you could share with us that might generally be good for people?
There are many, and if you are really curious, you can go online and look for stretches for any part of the body. The therapists I work at, as well as myself, have specific exercises for specific areas of the body and are more advanced in terms of that specificity than general stretches. But any stretch, particularly for the lower back itself, strengthening the abdomen, and working on the anterior, lateral, and posterior thighs, as well as the gluteal muscles, to loosen up that entire area will bring around a more permanent positive change than if somebody doesn't stretch.
And do you use any acupuncture in your practice at all still?
I use acupressure, I use cupping. I am not licensed to do acupuncture, although I've thought about it. But at the present time, I don't use the needles.
Yeah, I find the cupping or coining really powerful for, you know, distressed muscles in particular.
There are some patients that have come in that haven't responded to other techniques that I use cupping on, and they float out of the room. So yes, it's very effective.
Does anybody, who doesn't know what cupping is, right? All right, so do you want to explain cupping and coining?
Two different kinds of cupping is one with a plastic cup that you can put on, press down, and it creates the vacuum. Other people use a very thick glass with a little bit of cotton with a small amount of alcohol on it, light the cotton on fire, put it on the particular body part, and that creates the suction, the vacuum. So that is what is meant by cupping.
And this is from a Chinese medicine, and sometimes you'll see athletes at the Olympics or elite swimmers, and you'll see like round bruises on their body. And this is a technique that the Chinese have developed along with coining. But the idea is that your distressed muscle or seized up muscle has toxins in it. Stop me if I get this wrong. And it brings that out, and the whole muscle loosens up and stops being a force of evil in the body, as it were.
It's a bit of ridding toxicity, but it's also a means of suctioning particular points and areas of spasticity that get the patient to relax and add more flexibility.
Yes, this is the device this gentleman was referring to that he uses to roll on, etc.
Good, yes, this is very good for the back. I suggest people take golf balls, put it on a carpet and massage their feet with it, hitting the different reflex points, taking a different golf ball that's of course clean and using it to massage the hand with the reflex points there. I even tell people to get tennis balls, put it in, cleaned of course, laundered, and put it inside of an old gym sock or man sock, tie a knot in it, and put it underneath the neck to put on the upper, middle, lower neck to help relax and get more flexibility in the neck. Little things like this, in addition to rolling this, or there's similar for rolling on the feet. All these devices are things that you can do in your spare time that help you. They're very cheap.
This is probably very much like the shoe that has the bubbles in it, so that as you walk, you're massaging your foot.
I have seen those. I have seen sandals with those little protrusions, rubber knobs sticking up to massage the reflex points. I find nothing works for everybody, but you should try and see if it does help you. And if it does, you've found something else for your arsenal for self-care. If it doesn't work, well, at least you've tried and move on to something else.
Hello. Do you do any rolfing in your practice?
I do a little bit, especially on the abdomen to hit the anterior muscles of the spine from the stomach. And this is extremely effective. People who haven't gotten care improvement anywhere else respond very good to this. So yes, rolfing is a very good approach.
Applause for the guy who turned off the microphone. Now, a big round of applause for our chiropractor. Come over and we've got a little token of our esteem for giving this talk and answering so many questions. Just finally, let me say, it's good to have a chiropractor down here. I used to go up to Dr. Don. You know Dr. Don in Bangkok?
I don't think he's alive anymore.
No, he died. It's very inconvenient when a healer that really helps you a lot dies or retires.
I did go up and work at their clinic for a while to help them out when they were having a short supply of doctor, and they are carrying on his work.
Yeah, he was excellent. He was very young and fit, and he died of blood poisoning, I believe, something like that.
Something before his time.
Well before his time, yeah. He gave great neck adjustments. Anyway, thanks again. And of course, I'll interview you going out. If you've got any personal questions that you didn't want to share, just come and see Dr. Jeffrey. He'll be hanging around. And really, honestly, that's a very important resource to know and share with anybody who has any back or other issues. Thank you again, Dr. Jeffrey. All right.